My name is Matthew Berlet. I'm an interventional neuroradiologist at St. Joseph's Hospital. I also hold the title of Medical Director of the Comprehensive Stroke Center at St. Joseph's Hospital. Well, there are only a few scattered comprehensive stroke centers in Tampa. There are two types. There's a primary and a comprehensive. The primary can only treat the first 4.5 hours of what they call a dry stroke, or where a clot has gone to the brain. And they give an agent to dissolve clot. But beyond that, they don't offer any of the interventional aspects. In other words, they can't extract the clot. And oftentimes they have to transfer to a center that does. And we're able to treat strokes after 12 hours, including bleeding strokes like ruptured aneurysms or AVMs, which primary stroke center can't. So it's another level of care. We have neuro ICU, we have neurologists and neurosurgeons on call. So all these things factor into becoming a comprehensive stroke center. It's a much more involved process than a primary stroke center. The NOVA system is a way to measure the intracranial flow non-invasively. There's no other system that can do that. And what happens, we have a lot of patients that have diabetes, or they smoke, they have chronic hypertension, and they have areas of narrowing in the blood vessels inside the head. And there's very limited ways to treat that and limited ways to follow that. The NOVA allows us to, first of all, to diagnose it more accurately. Second of all, to follow it more accurately and determine when and if it needs treatment. And third of all, if they get treatment, to determine if the treatment was effective. And those are not available at any other hospital. Neuroventral radiology is on the vanguard of medicine right now. In other words, there are so many new developments happening in interventional neuroradiology, and it requires a significant amount of monetary input to keep up with these changes that are so rapidly occurring and are increasing the good outcomes of patients with stroke. In the past, if you had a stroke, what you did was you basically tried to keep the stroke that you had from getting bigger and prevent other strokes. Now we actually go in and pull the clot out to prevent the stroke from fully developing, and then also prevent other strokes. So it's a much different paradigm. The stroke attack team, or we just call it the stroke team, is critical because with brain, time is brain, right? In other words, as time goes by, your brain is dying. So we have got to push the patient through the system as quickly as possible. So what the stroke team does is actually they latch onto a patient where a stroke alert has been called, and they push the patient through the team to make sure that we meet all the benchmarks that are necessary to improve outcomes. And that would be, they get the CT scan within an hour with a report. They bring the patient to the angio suite. They determine when we puncture the artery, when we extract the clot. And this gives us data that we can use to again, improve patient outcomes. And the bottom line is, the faster you do it, the better the outcome. We did 140 patients last year, and we're hoping to do much more than that and help a lot more people.